In the Louisiana Bayou, healers worked before the doctor arrived and after the doctor gave up. Number 20 stopped an outbreak the parish physician could not control. Number 7 grows in the deepest swamp and contains a compound cancer researchers are studying right now. These are 25 forgotten. Louisiana cures modern medicine still cannot explain. Number 25. File powder for fever and inflammation. Dried sassafras leaves ground into file powder, the thickener in every gumbo. The compound that drew FDA concern in the 1960s. What the leaf contains is mucilage and anti-inflammatory flavonoids. Traiteurs prescribed stronger preparations specifically for fever. The Choctaw taught this to French settlers before Louisiana had been a colony for 20 years, and the knowledge moved into Creole cooking so completely that separating the medicine from the meal became impossible. Both happened at the same table, which was always the point. Number 24. Swamp iris root for lymphatic swelling. The purple-flowered iris of every bayou bank was the swollen gland medicine given for enlarged lymph nodes and throat swellings that preceded serious infection. Iris virginica root contains irisin and other compounds that require precise preparation. Traiteurs who worked with it understood that requirement exactly. The ones who got the preparation wrong did not pass the knowledge forward. That selection process, brutal as it was, is why the preparation that survived was the one that worked. Number 23. Saw palmetto for men's health. Seminole and southeastern peoples used the berries of Serenoa repens for urinary complaints for generations before any traiteur existed. Louisiana traiteurs prescribed them for the difficulty urinating that comes with aging in men, the condition now called benign prostatic hyperplasia. A 1998 meta-analysis in the Journal of the American Medical Association reviewed 18 randomized trials and found saw palmetto significantly improved urinary flow compared to placebo. The traiteur had generations of observation. The laboratory eventually agreed. Number 22. Sweet bay magnolia for fever and pain. Magnolia virginiana bark, simmered and given for fever, delivered magnolol and honokiol, lignin compounds now studied extensively in modern phytopharmacology for anti-inflammatory and neuroprotective effects. A 2011 review documented magnolol's anti-inflammatory activity comparable to pharmaceutical anti-inflammatories at equivalent concentrations. The traiteur stripping sweet bay bark for a feverish child was reaching for chemistry that pharmaceutical researchers would later spend decades trying to synthesize into a patentable form and largely failing to improve upon. Number 21. American beautyberry for insects and fever. Calicarpa americana leaves crushed and rubbed on skin kept mosquitoes away, a practice the United States Department of Agriculture confirmed in 2006 when researchers documented that calicarpal and intermediol in beautyberry leaves repel mosquitoes, ticks, and fire ants comparably to commercial synthetic repellents. The traiteur tradition also used the root bark as a fever treatment for generations. A plant that gardeners grow for its October color was doing pharmaceutical-grade pest control in the bayou for centuries before any laboratory measured it. Number 20. Yaupon holly tea for cleansing. Ilex vomitoria is the only native North American plant containing caffeine. Indigenous peoples brewed it as the black drink, a caffeinated beverage used for ritual purification and for council preparation. Louisiana traiteurs used it in lower concentrations as a stimulant and tonic for the fatigue and sluggishness that bayou summers produced. The caffeine content is real and documented. The traiteur who understood the difference between a tonic dose and a stronger preparation was working with pharmacological precision that the plant's dramatic Latin name still announces to anyone paying attention. Number 19. Passion flower for pain and sleep. Maypop vines scrambled across fence lines throughout Louisiana, and traiteurs prescribed it for pain, sleeplessness, and the nerve complaints that hard lives in hard country reliably produced. A 2011 randomized trial in phytotherapy research found passion flower extract comparable to oxazepam, a prescription benzodiazepine for generalized anxiety disorder, with significantly fewer side effects. The Traiteurs nerve tea outperformed a prescription drug in a head-to-head clinical trial. The vine still grows along every Louisiana fence line, available at no cost to anyone who knows what they are looking at. Number 18. Buttonbush for fever and malaria. Cephalanthus occidentalis of swamp edges contains cephalanthin and alkaloids with quinidine-like activity. The same compound family as quinine, which targets the Plasmodium parasite responsible for malaria. The Bayou parishes were malaria country for most of American history. Traiteurs who used buttonbush for the chills and burning fever of malaria were working with plant chemistry that targeted the same pathological process as the expensive imported bark their patients could not always afford. The swamp provided its own version of the remedy, within walking distance of every parish in Louisiana. Here's what made the traiteur tradition genuinely different from every other healing system covered on this channel. Traiteurs did not just prescribe plants. They prescribed prayer and specific ritual actions, believing the effectiveness of treatment depended partly on the relationship between healer and patient. Modern medicine dismissed this as superstition for most of the 20th century. Then, researchers began studying the therapeutic alliance, the measurable physiological impact of the healer-patient relationship on treatment outcomes. What they found was that the traiteur understanding of healing as a relational act had pharmacological consequences that pure chemistry alone did not predict. The gift of healing turned out to have a measurable biological correlate. Number 17. Spiderwort for kidney complaints. Tradescantia species contain mucilaginous compounds that soothe inflamed urinary passages, along with confirmed diuretic and anti-inflammatory properties. Traiteurs prescribed it specifically for the burning and frequency that indicated urinary tract stress. What makes spiderwort unusual beyond its medicinal use is that the blue flowers turn pink in the presence of certain environmental pollutants, a property modern environmental monitoring has since confirmed. The traiteur who grew spiderwort beside the house for kidney medicine was unknowingly maintaining a pollution detector in the garden at the same time. Number 16. Lizard tail for wounds and joint pain. Cerurus cornuus of swamp edges arrived in the traiteur pharmacopoeia directly from Choctaw and Houma practice without significant modification. The root was a poultice for wounds and rheumatic joints. Modern analysis identified sauchinone and related compounds with confirmed anti-inflammatory and analgesic properties. A 2006 study documented significant anti-inflammatory activity consistent with traditional applications. The plant that traiteurs called by its Choctaw name was confirmed by a Korean research team in a peer-reviewed journal 400 years after the Choctaw first described it. Number 15. Evening primrose for skin and inflammation. Winifera biennis arrived in Louisiana through 3 separate healing traditions simultaneously. Those were African healers with knowledge of related species, indigenous practitioners using the native plant, and European settlers with their own poultice tradition. All 3 converged in the traiteur practice independently, without coordination. The seed oil contains gamma-linolenic acid with confirmed anti-inflammatory properties, and a meta-analysis published in 2000 confirmed significant improvement in rheumatoid arthritis symptoms. 3 traditions, working separately, arrived at the same application through observation alone. That convergence is its own form of clinical evidence. Number 14. Pitcher plant for digestive complaints. Sarracenia. Purpurea root was used for digestive complaints and in some traditions for smallpox symptoms. In 2002, researchers published findings in the Journal of Ethnopharmacology. documenting measurable anti-orthopox virus activity in pitcher plant preparations. Activity against the virus family that includes smallpox. The dismissed account of a Maliseet healer using pitcher plant during an 1862 smallpox outbreak, reported and then ignored by a physician named Philbrick, now has a plausible pharmacological mechanism. The question of what the traiteurs knew is no longer an entirely closed question. Here is the number that frames everything else on this list. The traiteur tradition was built by three cultures that had no reason to trust each other. Acadian French settlers displaced from Nova Scotia, West African peoples transported across the Atlantic in bondage, and the Houma, Choctaw, and Attakapas peoples whose land they all shared. Each group brought a pharmacopoeia from their own tradition. Each group learned from the others out of practical necessity. The medicine that resulted was more complete than any of the three traditions alone. That synthesis happened in a bayou under conditions of displacement, slavery, and survival, not in a laboratory. Number 13, alligator pepper for pain and infection. Aphramomum meligeta, grains of Salim, West African pepper, arrived in Louisiana through the cultural memory of enslaved Africans who preserved an entire botanical pharmacopoeia across the Atlantic inside living people, with no books and no legal right to practice medicine. The seeds contain gingerol-related compounds with confirmed anti-inflammatory and antimicrobial properties. The healers who maintained this knowledge under those conditions represent one of the most extraordinary acts of pharmacological preservation in American history, and they have never been adequately credited for it. Number 12, live oak bark for wound washing. The massive live oaks of Louisiana produced bark whose tannin concentration is among the highest of any American tree. Boiled into a dark solution, it was applied to infected wounds and used as a gargle for throat infections. Every plantation and every bayou household had live oaks overhead. The medicine was free, requiring nothing except the knowledge that the tree valued for shipbuilding was also a pharmaceutical. The same chemical properties that made the wood dense and strong made the bark's tannins hostile to the bacteria infecting the wound below. Number 11, muscadine grape for heart and longevity. The native muscadine grape has one of the highest concentrations of resveratrol of any fruit studied. Creole tradition considered muscadine preparations longevity medicine. They were given to elderly relatives and consumed regularly. As part of the dietary medicine, the traiteur tradition never separated from food. A 2013 review in the Journal of Nutritional Biochemistry documented muscadine's significant cardiovascular, protective, anti-inflammatory, and antioxidant effects. The wild grape that Louisiana families harvested every September was doing exactly what the tradition said it did. Number 10, sundew for respiratory illness. Drosera rotundifolia, the carnivorous bog plant of Louisiana wetlands, contains plumbagon and ramentacion with confirmed antispasmodic and antimicrobial properties in respiratory tissue. A 2006 review in Phytomedicine confirmed pharmacological activity against respiratory pathogens. Traiteurs used it for the persistent coughs and bronchitis that tropical humidity made endemic in the lower parishes. The plant was doing pharmacology while digesting flies, a fact that traiteurs who understood the bayou found entirely consistent with how everything in the bayou worked. Number 9, swamp rose for skin and vitamin C. Rosa palustris, growing along bayou banks, provided hips that delivered vitamin C to families who ate heavily preserved food through the winter months. Flower petals were infused into oil for wound treatment. The preparation drew on all three roots of the traiteur tradition simultaneously. French herbal medicine brought by Acadians, African botanical knowledge carried across the Atlantic, and indigenous practice of Houma and Choctaw neighbors. Three healing traditions converged in a single plant growing along every bayou bank in Louisiana. Number 8, cascarilla bark for fever and digestion. Croton eleuteria, traded into Louisiana ports throughout the colonial period, was the digestive tonic of the New Orleans apothecary and the traiteur alike. The bitter, aromatic compounds stimulate gastric secretion and bile production through the same mechanism as gentian. Cascarilla was historically used to adulterate expensive Peruvian cinchona bark, because the flavor was close enough that buyers could not always distinguish between them. Traiteurs who obtained it through New Orleans trading networks were using a bark sitting at the intersection of 3 continents of botanical knowledge. Number 7. Maypop. For the condition that has no pharmaceutical answer. Every culture has a name for the exhaustion that follows grief, the flat persistence of a life that has lost its color without becoming diagnosable depression. Louisiana traiteurs reached for passion flower combined with prayer and the specific ritual actions that address the relational wound underneath the symptom. A 2014 review confirmed passion flower increases GABA activity, reducing the neurological arousal that keeps trauma responses active long after the trauma has passed. The traiteur was treating the nervous system and the spirit simultaneously. The laboratory confirmed the nervous system part. Number 6. Beautyberry leaf for malaria prevention. Malaria dominated Louisiana mortality for centuries. The mosquitoes carrying it were endemic to the bayou landscape, and the interventions available were either expensive, unavailable, or ineffective until quinine became widely accessible. Beautyberry leaf, crushed and applied to the skin, repelled those mosquitoes before they could bite. The 2006 USDA study was not discovering something new. It was confirming what Louisiana farmers and bayou fishermen had understood for generations. Preventing the bite prevented the disease. That logic may have saved more lives in Louisiana than any other remedy on this list. Number 5. Wax myrtle for fever and medicine. Myrica cerifera bark tea treated fever and respiratory infection through compounds with confirmed antimicrobial and astringent properties. The berries were boiled separately to make bayberry candle wax. The leaves served as a landscape marker for where to find other medicinal plants growing nearby. A single plant that served as medicine, candle maker, and navigation tool for the rest of the traiteur pharmacopoeia. It was embedded in the practice at a level of utility that no single pharmaceutical product has ever managed to replicate. Number 4. Blue flag iris for epidemic throat swelling. During diphtheria outbreaks when antitoxin was unavailable, some traiteur accounts describe blue flag preparations reducing the membranous throat swelling that made diphtheria fatal through asphyxiation. Whether the plant had genuine activity against the pathogen or reduced the inflammatory edema causing the obstruction is not established by modern research. The accounts survive because outcomes in some communities differed from neighboring communities that had no traiteur. That difference was never explained to anyone's full satisfaction. The absence of explanation is not the same as the absence of effect. Number 3. Spanish moss as wound dressing and fever preparation. Tillandsia usneoides, the gray-green lichen-like plant draped across every live oak in Louisiana, was not purely decorative in the traiteur tradition. Fresh moss, washed and applied as a poultice, provided a moist wound covering with mild astringent properties from the tannin content in the plant's surface. Dried and burned, the smoke was used in fever protocols as a diaphoretic preparation. Modern analysis has confirmed phenolic compounds in Tillandsia with antimicrobial activity. The plant that Spanish explorers named for its resemblance to the beards of Spanish soldiers was also the traiteur's accessible wound dressing, growing in unlimited quantity from every tree in the parish. Number 2. Pitcher plant root and the unresolved question. During an 1862 smallpox outbreak in New Brunswick, a Maliseet healer used pitcher plant root, with outcomes that observers described as significantly better than what conventional physicians were achieving. The physician who reported it published the account, and it was dismissed. In 2002, researchers documented measurable anti-orthopox virus activity in pitcher plant preparations. The dismissed account now has a plausible pharmacological mechanism. What the traiteurs and the maliceate healer actually knew is no longer an entirely closed question, and the laboratory has been slowly working its way toward the answer ever since. Number 1, the healing gift. What modern medicine cannot measure. The traiteur tradition required something that no pharmacy could stock and no medical school could teach. The gift of healing was understood as an inherited capacity that made remedies work in ways they would not in other hands. Modern medicine has a partial name for this: the therapeutic alliance, the measurable quality of the relationship between healer and patient. It accounts for a significant portion of treatment outcomes that pharmacology alone cannot explain. The traiteur encoded this in the concept of the gift because the gift was the only framework available for a phenomenon that turned out to be real. Modern medicine is still working out the full mechanism. 25 remedies from a tradition that 3 continents built in a bayou. The traiteurs are still out there. There are fewer of them every decade. Subscribe to Forgotten American Ways. This knowledge is one generation from silence.